Our first guest is Professor Christine Chomienne. Welcome, Christine. Are you there? Hello. She is not only the Vice Chair of the Mission Board of Cancer at the European Commission, but her extensive and brilliant resume and experience is frankly too much for me to cover. But let me just give you some highlights. Professor of Cellular Biology at the Université de Paris, Director and Research of Innovation at the French National Cancer Institute of France, by the way. Also Research Organization's President of the European Hematology Association, I almost got that wrong, and over 200 peer-reviewed publications and an abundance of awards. And frankly, despite that impressive resume, Christine, I still find you to be one of the most humble and personable people I have ever met. So welcome. Before we ask you to share with us your thoughts around leveraging data for clinical outcomes, could we ask you to explain really what is the Mission Board on Cancer and how does it work? Sure.
Okay, first slide, please. So we're waiting for the first slide to come on board. Yes, the missions were an approach to research and innovation that Horizon Europe has set forward to provide a new way to answer the challenges that society faces every day. Next slide, please. And so what's important, I think, for those who have not become aware of this new initiative from Horizon Europe, which of course, as you well know, follows Horizon Age 2020, which is, I think, something which is important for you so that all your important results and initiatives can now lean and feed into Horizon Europe's actions. The mission-oriented approach, as I said, is to bring a new way of programming research and innovation by taking the citizen and the patient for cancer and health at the center to be able to bring together all stakeholders to answer the challenges that each citizen faces every day. So this mission-oriented approach, Horizon Europe has identified 5 challenges. On top, you can see here in one of the circles is smart and neutral-free cities. Then you have on the right clean oceans and seas. You have, of course, climate at the bottom, and right top at the left, you have clean soils and forests. And then you have just one, which is directly linked to health, which is the mission cancer. All this, of course, has been leaning on extensive reports, which are down on the left, which have been written essentially by the economist, Professor Mariana Mazzucato, which gives us and gives the missions, cancer and all the other missions, guidance of how to make Horizon Europe think differently in programming research. Next slide, please. And so to be able to develop in this new field of programming research, and as Kurt has said, I've been involved in programming research in the last years in France, and it's true that this is a new way of programming research by consulting with different stakeholders before we define what types of actions we believe are necessary for research and innovations in the next coming years. And so, of course, all this consultancy of different stakeholders took all the mission boards, the 5 mission boards, more than a year, and we handed out all the 5 missions, our recommendations in September of last year to the commissioners. And as its research program, we handed it out, of course, to our new commissioner, Maria Gabriel. Concerning the mission cancer, so the one directly linked to health, at the bottom you can see that to follow the guidelines and the criteria of a mission, we need to identify a clear target. The clear target that we have identified is to save more than 3 million lives by 2030 and to have more patients living longer and better. So this is a mission criteria. We need to have a specific target which is quantifiable and this also in time, so 2030 for us. To reach this target, we have identified 5 intervention areas which are very clear to you who are linked to health. Leaning on 3 pillars, we have, of course, prevention, prevent what it's preventable, increased diagnosis and treatment, and of course, enhance quality of life of the survivors and of the cancer patients. This leans on a very important flaw, which is understand. A lot still needs to be collected on understanding cancers. And of course, it's important for us, as we are working at the European Commission, that all this, of course, is equitable in all member states. We are answering the challenges for all EU citizens. And so to reach these recommendations, we have worked with, as I've said, all these stakeholders, including patients and citizens, and we came out with 13 recommendations, and these have been published in September of last year, and you will soon be able to hear on the 22nd of September, I believe, of this year, how these recommendations have advised not only the European Beating Cancer Plan, which was launched 2 years ago, but also the implementation of Horizon Europe's future actions, and this will be made public later on in this month. So next slide, please. As I said, we've been working with citizens because mission approach needs to be able to be centered on patients and citizens' requests, and we need to have patients and citizens right up front in the design of the research actions that we want to develop. And these are a few sentences that have come back from the citizens and the patients concerning data. Share data and knowledge, I'll come back to that. Support a European Cancer Patient Digital Center. Support for a health passport. That not only contains relevant information on patients' clinical history and received treatment, but a tool that can also serve as an educational and an information tool. Patients should also have easy access to their own health data to strengthen the position of patients in shared decision-making. And there was a support for a more personalized prevention based on assessment of individual risk based on big data. So for us, it's crucial that not only do our scientific minds, including yours, really highlight the need to take advantage of artificial intelligence, machine learning, and all the data that is out there for the future breakthroughs, but patients and citizens are very much aware of that also. So in the next slide, I'll rapidly go through the 13 recommendations. Next slide, please. Right, there they are. So they're just the titles, but I'll go through the 13 ones. And as you will see, the 13 recommendations, which of course are necessary for our 5 intervention areas, clearly require the work that you have been doing the last years, leaning on the best use of collecting the data and then using it to be able to provide evidence that the policymakers and the hospitals and of course the physicians and the clinicians use them to be able to, of course, provide better care and better management of the patients. So the first one is Uncanny You. It's a European initiative to understand cancer. And this for us is collecting all the knowledge and all the data that is everywhere, including, I hope, the ones that are coming from your work, to be able to make it a platform where all patients and providers of cancer care will be able to find the necessary pathway to access the data. Next slide. So you can see here that the sentence in the recommendation is Uncanny You would encompass relevant stakeholders and enable integration of innovative models and technologies with longitudinal patient data and samples. So here we are stressing not only the need of collecting data, not only the need of collecting longitudinal patient data sample, which is missing, but also the need to collect sample. And of course, this is a tool to provide novel methods and novel models to be able to move forward in the understanding of cancer. Next slide, please. We also want to lean on polygenic risk scores by providing the opportunity of the population of citizens to give their genomes so that we can provide a whole genome EU database for the implementation of genomic and informatic infrastructures for data collection, dissemination to provide risk scores, of course, for cancer, but also for other diseases. Next slide, please. We also, of course, prevention is key, but you cannot prevent, yes, it was fine. Next slide. Yes, you cannot, of course, provide sufficient evidence to the patients and to the citizens if you do not collect the data of risk factors and provide this to the researchers in order to give the right evidence to citizens to comply to preventing cancer. Next slide. I think we have 2 slides moving forward. Sorry about all these clickings. Next one. We also believe that it's important to have a personalized medicine approach. This needs, of course, a large-scale intersector EU collaboration, and once again, advanced data analysis in personalized medicine. Next slide. There's another one, yes. And so here, of course, as I've said, it's important that we have successful research in the development of effective early diagnostics tools, integrated and driven by artificial intelligence, as well as in minimally invasive treatment strategies and technologies to lead to more cure and a better quality of life. Here again, I would just like to stress the need after preventing measures to have an early diagnostic, which is, of course, as you know, crucial for increased survival. And we really stressed in this recommendation the importance of data and driven artificial intelligence. Next slide. We have one also which scrutinizes important data which is needed on health-related and social and legal and short and long-term toxicities linked to treatment. And so this is probably linked to data on real-world data and longitudinal, but also on data that only citizens and patients can provide themselves, which are not always handy once they leave the hospital infrastructure. And this is really crucial to collect this data to be able, once again, to provide the necessary policy actions. Next slide. Of course, it's crucial, and it links very much to your work of the last 3 years, is we need infrastructures to be able to set the way and the path to how to get patients linking to hospitals and carers to be able to find the right setting to provide the data and for them also to collect their own data for their own use. And so we really believe that it's necessary that at least all member states have at least one comprehensive cancer infrastructures. We believe also that it's necessary that cancer infrastructures are networking inside each member state, and of course that they require networking across all member states. And we believe that this is one of the most important steps of collecting data in a quality assurance and consolidated manner. Next slide. Of course, we have a specific recommendation dedicated to children and young adults. And here again, it is really believed that it will only be by cross-linking data sets that better understanding of cancer, prevention of toxicities for a better, longer survival, and the testing of efficacy of innovative therapies needs to be able to lean on strong databases. Here for cancer in children, which relates also to rare cancers, it's crucial that this cross-linking is done, not only at the national level, across member states, but also worldwide, to be able to collect the data that is necessary for these rare events. Next slide. Of course, all this is linked to innovation, and we believe that it's probably necessary in these different types of actions that will need to bring together multiple stakeholders, that we need maybe to change some pathways and regulatory pathways of innovation. Last slide, I think, for this one. Right, and so I think it's in the title of your program, the word transforming. You will, of course, have understood, and I'm not the first one to be able to tell you this, that all this goes through, unfortunately, a very strong need to be able to make not only the citizens and the patients aware that cancer has transformed, and that there are other ways, of course, now of treating and providing research input. And so this needs also a strong communication in lay language at the national level, not only for the citizens and the patients, but also for policymakers, which unfortunately very often lack fluency in the standard English way of communicating. And then I'll finish. Next slide. Next slide. Right, so these were our recommendations, and as you can see, the work that you have been doing is really in line what we have recommended at the Mission Cancer Board with the patients and the stakeholders that we have communicated. And so therefore, we also stressed very much in the work that we have been doing this year to prepare the implementation of these actions, that whatever action Horizon Europe and even the Beating Cancer Plan, because we have been an advisory board also for the European Beating Cancer Plan against cancer, that whatever our recommendations and the actions that will come from them, they really lean on a very prepared field of scientists, healthcare professionals, some policymakers, some actions at different member states that can ensure Horizon Europe and the European Cancer Plan that the actions will be, of course, supported by very excellent teams that are ready to give and provide their input for the future Horizon Europe programs. So as I've said, and it's nearly summarized on this last slide, we have finished our work as an advisory board. The commissioners, all of them, have approved of the missions, the 5 missions work in June of this year, and they have validated now the implementation plans that have been provided leaning on the 5 missions. This will be set out in the next week, I think, or the next 2 weeks. And therefore, if you follow it, it's actions that will be developed during the next years of Horizon Europe. So it's not all going to be done in 1 year. But once again, I congratulate you on your work, and it will certainly be very important for you to liaise and to be able to find support in the European Commission's view of integrating data in health, and to be able to lean on the artificial intelligence technology to be able to guide us faster in finding breakthroughs for health. So thank you very much.
Thank you so much, Christine. And of course, we will see you at the Q&A later on. Right now, we have a very short break. The next session starts at 10:30. We'll see you very shortly. Thank you.